All right, welcome to lesson 5. We're going to be talking about collecting at time of service the patient balance. Let's get into it. So we're going to discover why collecting at the time of service is so important, the verbiage on what to say when you're collecting at time of service, and the verbiage to say when someone objects to paying at the time of service. Some resources for you. You're going to get all my scripts on collecting at time of service, scripts for objecting to paying, and blog posts that will go along with this subject. Let's get into it. Okay, so collecting at time of service. This is where those insurance breakdowns that we talked about comes in handy. If you've not listened to this lesson yet, I recommend you pause this and go back, listen to insurance breakdowns, how to get an insurance breakdown, and start doing that first. Because without those, it's very hard to give our patients a correct estimated portion that will be due when they come in for their visits. When we have that information in, then we can be confident that we are going to be giving our patients the best estimate that we can of their portion that will be due at the time of service. So this all begins at when you're presenting the treatment plan. So we're going to set the stage. So I'll give you an example. Mary's coming in for her cleaning, and when you check her out, it seems like she needs a crown on tooth number 18. So before she leaves, we are going to print off an estimate that's going to have her insurance estimated portion and her estimated portion. And we are going to let her know that that is due at the time she comes in. So we are just setting the stage that when she schedules this treatment, A, we're always going over patient estimations first, and then B, the patient portion is due when she comes in for that date of service. And so scripting. Mary came in, she had her crown done, and so then we're checking her out. Always, always, always use the word estimation. We all know insurance is always an estimation. We can never guarantee what insurance is going to pay. So when we're checking her out, we say, Mary, we're estimating your portion to be $671 today. How would you like to take care of that? And then silence. Let her tell you how she's going to pay for it. After you get her payment, I like to always follow up with, as I'm handing a receipt, if there's any difference in the portion due after we receive your insurance back, we'll send you a statement in the mail. Just a nice way to let them know up front. Again, insurance is never a guarantee of payment. If for any reason insurance doesn't cover what we've estimated, she will be due and we will be sending her a statement for the remainder of the portion due. It's just a good way to get, you're not shocking the patient that if they may owe more. My motto really is patients, they don't mind paying their dental bills, they mind paying their surprise dental bills. So again, we're just trying to take the surprise out of it, not shock them with a statement in the mail. Tell them when you collect their estimated portion due that if we get insurance back, if they do owe more, we will send them a statement in the mail. And it is the same thing too. If insurance would ever pay more, then they would have a credit on their account too. So it goes both ways. There's so many different objections to paying, especially if your office now does not collect at time of service. It is going to take a period of time to retrain your patients, but I promise you, if you just stick to the systems and protocols that payment is due at time of service now, it will get easier and easier with time. You're going to retrain the patients that they're going to pay when they come in for their date of service. But you're going to get objections at first, so just be ready for them. They're going to ask if they can just be billed like they always are. They might say they forgot their wallet. My husband pays the bill. Or can I just wait until insurance pays? So I have all of these objections and scripts to say back to the patients when they object to paying. But the main point here is just saying, when somebody comes back to you with that question of, can I just be billed? You just say, our payment guidelines have changed and payments due at time of service. How would you like to take care of that today? And then if they want to say, well, I kind of want to pay in payments. Well, great, absolutely. We offer financing like Care Credit, or I can take full payment today. Which would you prefer? So again, you're sticking to your guidelines for your office. You do offer financing, but it's not through your office. It's through Care Credit or whatever options that your office is comfortable with. So you're giving them the two options. Yes, we do have financing. This is it. Or we can accept full payment today. Which would you prefer? Again, it's just sticking to the guidelines that you've set in your office and just saying that is our protocol. I like to say, when you go to the grocery store, if you think about it this way, you go to the grocery store, you're checking out with all your groceries. You don't ever ask the cashier if you can pay later, right? You have to pay for your groceries when you buy the groceries at the time of service. Same thing for your dental work. We just had to retrain the patients that, when you come in and get the work done, payment's due at the time that you get it performed, not after. So it's just nice to keep that in mind, that if you think about all the things that we do on a normal basis, we need to pay at time of service for most things. So same way in dentistry. All right, so following up. So the easiest balances to collect are your newest balances. So this is why it is so important to pay at time of service, because the longer the patient goes without paying, the harder it is to collect that balance. You don't want to wait until it's 90 plus days overdue to collect that balance. So you want to note the day. So if you said, hey, Sue wanted to go home and she needed to get her credit card to pay for today's visit. Great, Sue. I'll follow up with you tomorrow if I haven't heard from you to get that payment over the phone. The key here is if you say you're going to follow up tomorrow, put that note in that you will follow up tomorrow. You want her to know that you're going to stick to what you say, and you are going to get that payment when you said you are. If someone says that you're going to go mail it when they get home, you say, okay, if I haven't received anything in a week, I'm going to give you a call and follow up to see if you need any help. Again, just letting them know we are going to follow up. We're not going to forget about you, but in a nice way, customer service oriented way. And just make sure you keep those notes and you don't miss when you say you're going to call someone to pay their balance, because the longer you go without them paying, the harder it is going to be for you to collect it. And then again, just follow up when you say that you are, so they know that you're serious about collecting. And if you don't hear from the patient, that's when they are going to fall into that patient AR protocol. This is what we're going to be going over in the next lesson. This is for your balances that have now aged 60 days and over. So there's a whole different protocol with letters and phone calls when we get into that. But we're doing this here, hoping that we don't have patients go to the overdue patient AR system. All right, so let's go over our collections procedures. So first, we're going to be collecting our patient's portion and any overdue family balance at the time of service. So when you are checking out the patient, you're going to collect everything that's overdue. And this is just a way, every single day checking your patient's charts, before the start of the day. See if their family has a balance, because you're going to want to collect that. If it's a large balance, you might even want to collect that before they go back to the chair. And if it's a small balance, for sure, you're going to want to include that and make sure you're seeing that patient, talking to that patient about their overdue balance. So we're collecting the patient portion, any overdue balance at the time of service. We're then sending off their insurance claim. Once we get that back, we're going to put in the insurance payment. And if there is any balance left over, we are going to immediately send our patient a statement in the mail. So we're not going to wait even until they show up at the next statement cycle. We're just going to batch it, send it right away. And then if it is not paid, time goes by, we're going to put them in our patient AR protocol, which I'll move that here, which we'll go over next week. All right. And so here's your homework. I have a lot of resources, a lot of scripting for this week. So I want you to print them, and I want you to role play the scenarios as a team in the office. So how I used to do it in the office is we would actually have one team member be a patient and the other one be the person who is collecting at time of service, and role play different objections and how it would go in real life. I promise you, it's a little silly at first, but it is one of the number one ways to learn how to speak to your patients and be comfortable talking to patients about payment arrangements is to role play it. So that is one of your homework. 2, start sending statements to patients with a balance immediately after putting in their insurance checks. So don't wait until you send statements. Immediately send those off once you put in insurance and if they have a leftover balance. And then lastly, and most importantly, stand firm on collecting at time of service. That policy is a new policy now in your office. So you're going to remember to set the stage when you're going over treatment, and you're going to stick to your guns. When you say that you're collecting at time of service, our payment guidelines have changed. We are now collecting at time of service. We're estimating your portion to be this. How would you like to take care of that today? It's very nice, sticking to it. And I promise you, once you get through a few months of retraining your patients, you will never look back. So remember, coaching calls Wednesday at 1 p.m. Don't forget to look below. Your downloads are right here underneath this video, and bring all your questions on Wednesday's coaching call. See you guys then.